Question 1. A 52-year-old male collapses while exercising. He is unresponsive and not breathing normally. After ensuring scene safety and checking for a pulse, you cannot feel a definite pulse within 10 seconds. What is your immediate next action? A. Open the airway and give 2 rescue breaths. B. Go call 911/EMS and get an AED. C. Begin chest compressions at a rate of 100 to 120 per minute. D. Perform a head tilt, chin lift maneuver and reassess breathing and pulse. Answer: C. Begin chest compressions at a rate of 100 to 120 per minute. This question tests your immediate response to a cardiac arrest situation in an adult. The crucial clue is cannot feel a definite pulse within 10 seconds, which confirms cardiac arrest and necessitates starting chest compressions immediately after checking for a pulse. High-quality chest compressions are the most critical intervention in adult cardiac arrest, directly circulating blood to vital organs. For example, if you spend too much time on breaths or calling for help before starting compressions, the patient's chances of survival decrease significantly. Always remember that compressions are key. If no pulse or definite pulse is found, start compressions without delay. Question 2. You are performing CPR on an adult. What is the maximum duration you should interrupt chest compressions for any reason, including ventilations or AED pad placement? A. No more than 5 seconds. B. No more than 10 seconds. C. No more than 15 seconds. D. No more than 20 seconds. Answer: B. No more than 10 seconds. This question focuses on minimizing interruptions during CPR, a critical component of high-quality CPR. The guideline specifies that chest compressions should be interrupted for no longer than 10 seconds to maintain continuous blood flow to the brain and heart. This includes pauses for ventilations, rhythm analysis by an AED, or switching compressors, as frequent or prolonged interruptions significantly reduce the effectiveness of CPR. For example, stopping compressions for too long to give breaths means less oxygenated blood reaches the brain. Always strive for continuous compressions, keeping any interruptions under the 10-second limit. Question 3. A 7-year-old child collapses. You find him unresponsive, not breathing, and without a pulse. You are alone. When should you activate the emergency response system? Call 911/EMS. A. After 2 minutes, 5 cycles, of CPR. B. Immediately after confirming unresponsiveness and no breathing/pulse. C. After retrieving and applying an AED. D. While performing chest compressions. Answer: A. After 2 minutes, 5 cycles, of CPR. This question addresses the call first versus care first guideline, which is different for children than for adults when you are alone. For an unwitnessed collapse of a child or infant where you are alone, the priority is to provide 2 minutes, about 5 cycles, of CPR first, as respiratory arrest is often the primary cause in children. For instance, if a child chokes and then collapses, providing immediate CPR can help clear the airway or address the resulting cardiac arrest faster than calling for help right away. Remember, for children, if you're alone and the collapse was not witnessed, care first for 2 minutes, then call for help. Question 4. You are responding to an unresponsive adult. After establishing unresponsiveness, you check for breathing and observe only occasional gasps. What does this indicate? A. The person is breathing normally and does not require CPR. B. The person is experiencing an opioid overdose and needs naloxone. C. These are agonal breaths, which are not effective breathing and indicate the need for CPR. D. The person is about to wake up and simply needs monitoring. Answer: C. These are agonal breaths, which are not effective breathing and indicate the need for CPR. This question tests your ability to recognize ineffective breathing patterns that signify cardiac arrest. Agonal breaths are gasping, snorting, or gurgling sounds, often described as noisy or labored, and are a common sign of cardiac arrest, not normal breathing. It is a crucial clue that the heart has stopped or is about to stop. Treating agonal breaths as normal breathing and delaying CPR can have fatal consequences. For example, someone might make a few loud, infrequent gasps, but if there's no normal breathing, you must start CPR. Always recognize that agonal breaths are a sign of cardiac arrest and require immediate intervention with chest compressions. Question 5. When administering ventilations with a bag mask device to an adult in cardiac arrest, how often should you deliver a breath? A. Every 3 to 5 seconds, 10 to 12 breaths per minute. B. Every 5 to 6 seconds, 10 to 12 breaths per minute. C. Every 6 to 8 seconds, 7 to 10 breaths per minute. D. Every 10 seconds, 6 breaths per minute. Answer: B. Every 5 to 6 seconds, 10 to 12 breaths per minute. This question focuses on the correct rate of rescue breaths for an adult during bag mask ventilation, which is a key component of effective CPR. For an adult in cardiac arrest, rescue breaths should be delivered every 5 to 6 seconds, which translates to approximately 10 to 12 breaths per minute, ensuring adequate oxygenation without causing hyperventilation. Delivering breaths too quickly can increase pressure in the chest and reduce blood flow back to the heart. For example, if you are performing CPR with a partner, the person giving breaths should count out 5 to 6 seconds between each breath while compressions continue. Remember to give just enough air to see a visible chest rise, not full forceful breaths. Question 6. You are performing CPR on an adult when another rescuer arrives with an AED. What is the very first step you should take once the AED is at the patient's side? A. Stop CPR and immediately apply the AED pads. B. Turn on the AED and follow its prompts. C. Continue compressions while the other rescuer attaches the pads. D. Pause compressions to check for a pulse. Answer: B. Turn on the AED and follow its prompts. This question emphasizes the immediate and critical first step when an AED arrives during CPR. The very first action upon the AED's arrival is to power it on, as the device will then guide you through the subsequent steps. Turning it on first allows the AED to begin analyzing and instructing you, minimizing delay in delivering a potentially life-saving shock. For instance, the AED's voice prompts will tell you exactly what to do next, like apply pads to patient's bare chest. Always prioritize turning on the AED the moment it reaches the scene. Question 7. When performing chest compressions on an adult, what is the recommended depth? A. At least 1 inch 2.5 centimeters. B. At least 1.5 inches 3.8 centimeters. C. At least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters. D. At least 2.4 inches 6 centimeters. Answer: C. At least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters. This question tests your knowledge of the precise compression depth for adults, a critical component of high-quality CPR. The guideline specifies a depth of at least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters to ensure effective blood circulation without causing injury. Compressing too shallowly will not adequately pump blood, while compressing too deeply can increase the risk of injury. For example, aim to push down about 1/3 of the depth of the chest, which for most adults falls within this range. Remember, 2 to 2.4 inches is the sweet spot for adult chest compressions. Question 8. You encounter an unresponsive 9-month-old infant. You confirm unresponsiveness and no breathing/pulse. You are alone. Which chest compression technique should you primarily use for single rescuer CPR on an infant? A. 2 hands, one on top of the other, on the lower half of the sternum. B. 1 hand on the center of the chest. C. 2 fingers, index and middle finger, on the lower half of the sternum. D. 2 thumbs encircling the chest, hands supporting the back. Answer: C. 2 fingers, index and middle finger, on the lower half of the sternum. This question specifically addresses the recommended chest compression technique for a single rescuer on an infant. For a lone rescuer performing CPR on an infant, the 2-finger technique, placed just below the nipple line on the sternum, is preferred due to its ease of use and ability to achieve adequate depth. While the 2-thumb encircling technique is highly effective and preferred for 2 rescuers, it can be cumbersome for one person to also manage the airway. For example, if you are alone, using your index and middle finger allows you to maintain the airway with your other hand if necessary, and deliver consistent compressions. Remember to use the 2-finger technique when you are the only rescuer for an infant. Question 9. During CPR, what is the recommended compression to ventilation ratio for a 5-year-old child with 2 rescuers present? A. 30 compressions to 2 breaths. B. 15 compressions to 2 breaths. C. 15 compressions to 1 breath. D. 30 compressions to 1 breath. Answer: B. 15 compressions to 2 breaths. This question tests your knowledge of the specific CPR ratio for children when 2 or more rescuers are present. For child CPR with 2 rescuers, the compression to ventilation ratio is 15 compressions to 2 breaths, which optimizes the balance between blood flow and oxygen delivery for children. This ratio differs from adult CPR, 30:2, and single rescuer child CPR, 30:2, highlighting the importance of recognizing the patient's age and number of rescuers. For instance, if you and a partner are performing CPR on a child, you would switch roles after every 15 compressions, ensuring that compressions are paused only for the 2 breaths. Always remember that for 2 rescuers and a child, it's 15 and 2. Question 10. A conscious adult begins choking while eating in a restaurant. They are coughing forcefully. What is your immediate action? A. Immediately perform abdominal thrusts. B. Encourage them to continue coughing. C. Call 911/EMS immediately. D. Begin back blows. Answer: B. Encourage them to continue coughing. This question focuses on the initial management of a conscious choking adult, differentiating between a mild and severe airway obstruction. The key clue is coughing forcefully, which indicates a mild obstruction where the person is still able to move some air. In this scenario, encouraging the person to keep coughing is the most appropriate initial action, as their own efforts are often the most effective way to clear the obstruction. For example, if someone is coughing forcefully on a piece of food, allow their natural reflexes to work before intervening. Only if the coughing becomes weak or stops, or they become unresponsive, should you proceed to abdominal thrusts. Question 11. You are performing CPR on an adult when another trained rescuer arrives. To ensure high-quality CPR, how often should rescuers switch roles during compressions? A. Every 5 minutes or when fatigued. B. Every 2 minutes, approximately 5 cycles, or when fatigued. C. Only when the AED is analyzing the rhythm. D. Only if the initial compressor requests to switch. Answer: B. Every 2 minutes, approximately 5 cycles, or when fatigued. This question addresses the importance of effective team dynamics and fatigue management in high-quality CPR. Rescuers should switch roles, particularly the compressor role, approximately every 2 minutes, or after about 5 cycles of CPR, or sooner if they feel fatigued, to maintain high-quality compressions. Compressor fatigue leads to shallower and slower compressions, reducing CPR effectiveness. For instance, in a 2-person team, one person counts the cycles while the other compresses, and they switch after 2 minutes to ensure consistent, deep compressions. Regular switching helps prevent fatigue, ensuring optimal chest compression depth and rate. Question 12. You have successfully resuscitated an unresponsive adult who is now breathing normally and has a strong pulse. What is the most appropriate position to place them in if you suspect no spinal injury? A. Supine, lying flat on their back. B. Prone, lying flat on their stomach. C. Recovery position, on their side. D. Sitting upright. Answer: C. Recovery position, on their side. This question tests your knowledge of the recovery position, which is used for a breathing, unresponsive patient without suspected spinal injury. Placing the patient in the recovery position, on their side, helps maintain an open airway and prevents aspiration, breathing in vomit or fluids, by allowing fluids to drain from the mouth. Leaving them on their back risks the tongue falling back and blocking the airway or vomit being aspirated. For example, if someone is unconscious but breathing, carefully roll them onto their side with their head supported to keep their airway clear until advanced medical help arrives. Always prioritize a clear airway for an unresponsive, breathing patient. Question 13. A 6-month-old infant is unresponsive, not breathing, and has no pulse. What is the appropriate chest compression depth for this infant? A. At least 1 inch 2.5 centimeters. B. Approximately 1.5 inches 4 centimeters or 1/3 the depth of the chest. C. At least 2 inches 5 centimeters. D. Approximately 2.4 inches 6 centimeters. Answer: B. Approximately 1.5 inches 4 centimeters or 1/3 the depth of the chest. This question assesses your knowledge of the specific compression depth required for infants, which differs from adults and children. For infants, the recommended compression depth is approximately 1.5 inches 4 centimeters or about 1/3 the depth of the chest, whichever is less, to ensure effective blood circulation. Compressing too shallowly is ineffective, while too deep can cause injury. For example, when using the 2-finger technique, visualize pressing down firmly but gently enough to achieve this specific depth. Always remember that for infants, it's about 1/3 the depth of the chest, or roughly 1.5 inches. Question 14. What is the correct hand placement for performing chest compressions on an adult? A. Over the xiphoid process, tip of the sternum. B. On the upper half of the sternum. C. In the center of the chest, on the lower half of the sternum. D. Directly over the nipple line. Answer: C. In the center of the chest, on the lower half of the sternum. This question focuses on the precise hand placement for adult chest compressions, a crucial detail for effective CPR. Proper hand placement is in the center of the chest, on the lower half of the sternum, breastbone, avoiding the very bottom tip, xiphoid process, or the ribs, to ensure compressions are delivered effectively to the heart. Incorrect placement can lead to ineffective compressions or injury. For instance, you can locate this spot by finding the bottom of the breastbone and placing the heel of your hand just above it in the center. Always ensure your hand placement is accurate for optimal compression delivery. Question 15. You are assessing an unresponsive person. After opening the airway, you listen for breathing. You hear gasping sounds and see no normal chest rise and fall. What should you conclude? A. The person is breathing normally, and CPR is not needed. B. The person requires immediate rescue breaths only. C. The person is in cardiac arrest and requires CPR. D. The person is experiencing a seizure. Answer: C. The person is in cardiac arrest and requires CPR. This question tests your ability to interpret agonal gasps as a sign of cardiac arrest, not normal breathing. Gasping sounds that are infrequent, weak, or noisy are not considered effective breathing and are a common sign that the heart has stopped or is failing. Recognizing agonal gasps as a sign of cardiac arrest is crucial, as immediate chest compressions are necessary to improve the chance of survival. For example, if someone takes a sudden, deep gasp every 10 to 15 seconds but otherwise isn't breathing normally, that's a red flag for cardiac arrest. Always remember that gasping is not breathing and signals the need for immediate CPR. Question 16. You witness a 10-year-old child collapse suddenly. You are alone. After confirming unresponsiveness and no breathing/pulse, what is your immediate next step? A. Provide 2 minutes, 5 cycles, of CPR. B. Immediately activate the emergency response system, call 911/EMS. C. Check for signs of choking. D. Look for an AED. Answer: B. Immediately activate the emergency response system, call 911/EMS. This question highlights a critical distinction in the call first versus care first guideline, specifically for witnessed collapses in children. When a child's collapse is witnessed, it is more likely due to a cardiac cause, similar to an adult cardiac arrest. Therefore, immediately activating EMS is the priority to get advanced help and an AED quickly. For instance, if you see a child suddenly fall during a game, assume it's a cardiac issue and call for help right away before starting CPR. Remember, if you witness the collapse of a child, call 911/EMS first. Question 17. After delivering a shock with an AED to an adult, what is your immediate next action? A. Reassess the pulse and breathing. B. Continue chest compressions immediately. C. Remove the AED pads. D. Deliver another shock immediately. Answer: B. Continue chest compressions immediately. This question clarifies the critical action directly following an AED shock, emphasizing the importance of uninterrupted high-quality CPR. After delivering a shock, you must immediately resume chest compressions, without pausing to check for a pulse or breathing, because the heart needs continuous blood flow. The AED will reanalyze the rhythm after 2 minutes of CPR and prompt another shock if necessary. For example, once the AED announces shock delivered, you should be ready to place your hands back on the chest and start compressions within seconds. Always remember that after a shock, the immediate priority is to resume chest compressions. Question 18. You are performing CPR on an adult. You deliver 30 compressions and are about to give 2 breaths. How long should each breath last? A. 0.5 seconds. B. 1 second. C. 1.5 seconds. D. 2 seconds. Answer: B. 1 second. This question tests the appropriate duration for rescue breaths during CPR, a small but important detail for effective ventilation. Each rescue breath should be delivered over approximately 1 second, just long enough to make the chest visibly rise. Delivering breaths too quickly or forcefully can cause air to enter the stomach, leading to complications like vomiting, while too long can increase interruptions to compressions. For example, when you give the 2 breaths, imagine saying 1/1000 for each puff of air. Aim for a gentle, visible chest rise over 1 second per breath. Question 19. A 2-year-old child is choking and becomes unresponsive. You have already performed back blows and abdominal thrusts without success. What is your next immediate step? A. Call 911/EMS. B. Begin CPR, starting with chest compressions. C. Continue abdominal thrusts more forcefully. D. Perform a finger sweep to clear the airway. Answer: B. Begin CPR, starting with chest compressions. This question addresses the specific BLS protocol for a choking victim who becomes unresponsive. When a choking victim becomes unresponsive, the priority shifts to CPR, as the compressions may help dislodge the object, and ventilations are still attempted. Do not perform blind finger sweeps, as this can push the object further down. For instance, if a child choking turns blue and goes limp, you would immediately start chest compressions and attempt breaths, looking for the object only if you see it. Always begin CPR if a choking victim becomes unresponsive, incorporating airway checks before each set of breaths. Question 20. Which of the following is considered the most critical component of high-quality CPR for improving survival rates? A. Minimizing interruptions in chest compressions. B. Providing adequate ventilations. C. Using an AED as soon as it is available. D. Ensuring correct hand placement. Answer: A. Minimizing interruptions in chest compressions. This question asks about the single most critical component of high-quality CPR, a concept frequently emphasized in BLS training. While all listed options are important for effective CPR, minimizing interruptions in chest compressions is paramount because it ensures continuous blood flow to the brain and heart. Each pause reduces vital blood flow. For example, delaying compressions to check a pulse too long, or taking too long to give breaths, directly reduces the patient's chance of survival. Always focus on delivering continuous, uninterrupted chest compressions as much as possible. Question 21. When should you activate the emergency response system, call 911/EMS, for a drowning victim who is unresponsive and not breathing normally? A. Immediately after confirming unresponsiveness and no breathing. B. After 2 minutes, 5 cycles, of CPR. C. After you have successfully cleared their airway. D. As soon as an AED is applied. Answer: B. After 2 minutes, 5 cycles, of CPR. This question tests a specific scenario where the care-first principle applies due to the likely cause of cardiac arrest. For drowning victims, the primary cause of cardiac arrest is typically respiratory, meaning oxygen is urgently needed. Therefore, you should provide 2 minutes, approximately 5 cycles, of CPR first, prioritizing oxygenation, before activating EMS if you are alone. For instance, if you pull an unresponsive drowning victim from the water, immediately start CPR and provide breaths, then call for help after 2 minutes. Remember, for drowning victims, care first by starting CPR immediately. Question 22. You are using an AED on a child. The AED prompts check pads. What is the most likely reason for this message? A. The AED battery is low. B. The child is too small for the AED pads. C. The AED pads are not making good contact with the skin or are incorrectly placed. D. The AED is malfunctioning. Answer: C. The AED pads are not making good contact with the skin or are incorrectly placed. This question targets a common troubleshooting prompt from an AED during use. The message check pads almost universally indicates that the AED detects an issue with the pad connection to the patient's skin, either due to poor adhesion, incorrect placement, or moisture interference. It is crucial to immediately check and ensure the pads are firmly and correctly applied to a dry, bare chest. For example, if the pads are not sticky enough or hair is preventing good contact, the AED cannot properly analyze the heart's rhythm. Always ensure good pad contact and correct placement if the AED prompts check pads. Question 23. An adult patient is unresponsive, has a strong pulse, but is not breathing. You have opened the airway. What is your immediate next step? A. Begin chest compressions. B. Give one rescue breath every 5 to 6 seconds. C. Call 911/EMS and wait for their arrival. D. Place the patient in the recovery position. Answer: B. give one rescue breath every 5 to 6 seconds. This question describes a specific scenario where the patient is in respiratory arrest but still has a pulse. When a patient has a pulse but is not breathing normally, or at all, the immediate priority is to provide rescue breaths to deliver oxygen to their vital organs. Administer one breath every 5 to 6 seconds for an adult, ensuring each breath makes the chest visibly rise. For instance, if you check for a pulse and find one, but the person isn't breathing, you would immediately start rescue breathing instead of compressions. Remember, pulse but no breathing means rescue breaths. Question 24. While performing CPR on an adult, what is the maximum recommended fraction of time that chest compressions should be performed? Chest compression fraction. A. At least 50%. B. At least 60%. C. At least 70%. D. At least 80%. Answer: B. At least 60%. This question introduces the concept of chest compression fraction, CCF, which measures the proportion of time spent performing chest compressions during CPR. Guidelines recommend a chest compression fraction of at least 60%, meaning that at least 60% of the total resuscitation time should be dedicated to compressions, minimizing pauses for other interventions. Achieving a high CCF directly correlates with better patient outcomes, as it ensures consistent blood flow. For example, if you are doing CPR for 10 minutes, at least 6 minutes should be dedicated to uninterrupted compressions. Aim for the highest possible CCF to maximize the effectiveness of your CPR. Question 25. You are caring for an infant who has a severe foreign body airway obstruction and is conscious. You have delivered 5 back blows. What is your next immediate action? A. Reassess the infant's breathing and cough. B. Deliver 5 chest thrusts. C. Call 911/EMS. D. Begin CPR. Answer: B. Deliver 5 chest thrusts. This question tests the sequence of actions for a conscious infant with a severe choking incident. After delivering 5 back blows, the next immediate action is to deliver 5 chest thrusts, alternating between the 2 maneuvers until the object is dislodged or the infant becomes unresponsive. This combination of forces helps to dislodge the foreign body effectively. For example, after firmly delivering 5 back blows between the shoulder blades, you would immediately turn the infant over to deliver 5 quick chest thrusts on the breastbone. Always remember to alternate 5 back blows with 5 chest thrusts for a choking infant until the obstruction is cleared or they become unresponsive.